to the Sunday Business Page.
Frequent mass shooting incidences or domestic terrorism involving the use of a knife, such as the Franklin regional stabbing case, remind us of the troubled state of many teens in America. It's estimated that 1 in 5 teens experiences a seriously debilitating mental disorder, yet less than half of them are provided with mental health treatment. Even fewer are treated for substance abuse. Some of those who were seen said their care was ineffective, and the long-term cost to address this problem is staggering. Well, Pittsburgh's Jewish Healthcare Foundation is launching a multi-year adolescent behavioral health initiative. It's designed to improve prevention and treatment services for children and teens. Dr. Karen Feinstein is president and CEO of the Jewish Healthcare Foundation. She joins us now on the Sunday Business Page to talk about this important effort. Karen, welcome to the show. First, thank you for all the good work that you and your foundation do in this community. It's so much appreciated. This issue of mental health among teenagers, how bad is it?
The data are overwhelming. We have, the data you cited are pretty compelling.
1 in 5?
How about 17% of teenagers have seriously considered suicide? And we have, among all developed countries, we have among the highest rates of teens who actually inflict serious injury on themselves, highest rates of teens who are involved in violent episodes,
right,
highest STDs, teen pregnancies. You go down the list.
Right.
You can't ignore the fact that we're not doing a very good job.
And this cuts across all economic and racial stratas, doesn't it?
Absolutely. And in fact, the thing that there's a wonderful report from the Institute of Medicine, Shorter Lives, Poorer Health, and they blow out of the water any thought that this is related to any particular racial demographic group. This cuts across all income groups and all racial and religious groups.
And you folks at the Jewish Healthcare Foundation are undertaking a special initiative, I gather, beginning this May. Tell us what you're up to.
Well, it's sort of the problem that can't be ignored, even just looking at the data. But then you have all the anecdotal data, all of the staff members and friends and professional colleagues who've come to us, and you hear the same thing over and over. My child was in desperate need of help, and I couldn't get it.
Right.
Either I couldn't find a therapist who could resonate with me and my child, or I put them in institutional care in a residential setting and they got worse. I put them in a residential setting and they started cutting themselves. I put them in a setting and they found a heroin dealer.
Ugh.
We hear these stories over and over. So you say, well, you know, those are anecdotal. That's beyond the evidence. It is, but I'm talking to very capable people who in every other way manage their lives well. So I think somewhere as a community, we have to stop and take stock of how are we doing here. And because many of these problems surface in the U.S. before the age of 14,
all right,
we've got to start early, and we've got to get better at predicting someone heading into trouble.
Yeah, I'll tell you, I was looking at some of the component parts of this program that you're beginning, and obviously you've just talked about, you know, identifying evidence-based and cost-effective treatment programs and prevention programs. Obviously that's clear. But you're going to also develop and pilot an app to assess, inform, and connect teens to credible and effective behavioral health information and support services. I love this idea because we all know that all these kids are using their phones all the time.
Yes.
An app, great idea. Where are we with that?
We have a team of young people. They were part of a fellowship we offer. And as part of the fellowship, they developed the outline of an app. And we looked at it and we said, this would be terrific. You know, adolescent years are years where people are discovering their privacy. It's a time when teens want a lot of what they do to be kept somewhat secret from their parents. So although we say, oh, in a perfect world, you'll go to your parent and they'll help you through a problem, we know that a number of teens are going to look for their own answers, and they're going to go where they go for every other answer, to the internet. So when a group of some of our, these were graduate students in the health professions, medicine, nursing, others, when they came up with this great idea to help teens themselves connect, we decided to sponsor them in turning it into the real thing.
I love it. I think it's great, and I hope it just flies, because I think that's exactly the way young people will communicate. You're also going to work on increasing access to effective behavioral health and trauma-informed services by working with schools and primary care physicians. What's your thought there? What's your plan?
Well, with adults, we believe, and we've tested it now, thank the federal government with 3 significant grants, it's very effective to screen for mental health problems in primary care, because most adults have a primary care provider, and it's where they go for an assessment of their health status. Right. So if we can screen in the primary care setting, even if the problem is more serious than the primary care doctor and his team can deal, or her team can deal with, they can at least refer. They know there's a problem, they refer. One of the challenges with teens, as we all know, it's a weird time of life in terms of connection to a permanent provider. Right. Many of them feel that they've kind of outgrown their pediatrician, but they haven't yet moved on to a primary care provider. I know exactly
what you're saying. My 20-somethings were sort of, you know.
They're sort of in between. Use the word.
They're really beyond the pediatrician.
Tween, that's where tween came from, right. Sort of in between. So, although we are very big proponents of screening in any primary care setting, we also are realistic that teens may be a challenging demographic.
They sure are, in all kinds of ways. Dr. Karen Wolk-Feinstein, thank you so much for coming in on the show, Karen, and sharing this with us. Good luck to you on this initiative in May, and I'm sure we're going to have you back to report on it. Thank you again.
Thank you.